past, we had a system where nearly anyone could fill out a form and become a Medicare provider. In a matter of weeks, criminals could set up false clinics, enlist willing accomplices and vulnerable seniors to submit false claims, and begin very quickly collecting payments.
Welcome back to The Heat. We're talking to Paul Vincke, Managing Director of the European Healthcare Fraud and Corruption Network. With him, Heather Foster, Chair of the Canadian Healthcare Anti-Fraud Association. And joining us for this part of the show, Raphael Katz, a litigator in New York who specializes in healthcare fraud prosecutions. Raphael, welcome to you to the show. Let's talk about the United States. It has some of the highest healthcare costs in the world. How big is the problem of healthcare fraud here?
Well, it's huge in the United States and on a national scale as well. Just last year, it was estimated that there was $65 billion of healthcare fraud, $60 billion of which was attributed to where the United States was a payor under the Medicare Medicaid system. So the United States itself the government was actually defrauded, and ultimately United States taxpayers as well. And healthcare fraud is any time where there's a claim by an individual business for something they are not entitled to, and it really takes many forms in the United States. You see claims for services never provided, claims for double billing for services, claims for defective products, adulterated drugs, and kickbacks paid to incentivize the provision of perhaps even harmful products.
So, Raphael, do you find that most of the fraud's taking place in the federal programs like Medicare and Medicaid, or is it in the private programs, the private insurance companies, managed care and things like that?
Well, you see it in private care and insurance programs. I think you're going to see it more, and it's more of a problem in the government programs. With the insurance programs, premiums can be raised, it can be addressed that way, though there has been a crackdown on the private side as well. But just looking at those numbers of the $60 billion of that $65 billion last year coming from Medicare and Medicaid programs, and there are other government programs as well, such as the Program for Armed Forces, you can see what a problem that is. And the United States, the problem is elsewhere too, but the United States has taken steps to address that problem more than on the international scene.
Okay, let's go back to Dallas, to Paul Vincke. Paul, Belgium has had some success in countering healthcare fraud by using a centralized information system that's for all the social security benefits that people get in the country. How does that work, and why has it been successful in recovering money lost to healthcare fraud?
Well, having access to valid data and reliable data is paramount, is a key factor for being successful in investigating and detecting fraud. If you have a system available that can be used by counter-fraud units and counter-fraud organizations in order to analyze the data and find anomalies, this is the first and most important step to detect and then investigate the fraud. If you don't have the data available in an aggregated and validated way, as it's the case in a number of countries in Europe, the usual suspects in the east and in the south of Europe, you'll have a very hard time even beginning to detect where the fraud is. So that's one of the reasons why in Belgium we have been quite successful, as the data are available.
And Heather, what has been the experience in Canada? Is there a tough, strong, how can I put it, law enforcement infrastructure to counter healthcare fraud?
For the most part, law enforcement doesn't play a huge role in healthcare fraud in Canada. Basically, it's known as a victimless crime. It's very difficult to get law enforcement to accept cases unless it's on a wide scale. Basically, law enforcement, they try, mostly with physicians, they will do investigations, but for private party payers, they don't have that much of an interest.
Raphael, I want to ask you a question that I asked Heather earlier on, and that is whether most of the fraud that is committed here in the United States is committed by physicians or by consumers. And when I say physicians, I mean other therapeutic providers as well.
Well, I think where you see the biggest, first of all, the biggest crackdown on where government cares most is by the providers themselves, not individuals, because there you have huge billions of dollars, millions of dollars of fraud committed by single providers. For example, last year there was one provider, $77 million of fraud in Brooklyn, New York, where she was running the clinic and billing for services never provided, and even enlisting individuals to pose as physicians, pretend to be doctors, and providing services and billing them. So I think that is where the crackdown has been, and the United States has employed many different tools to address the problem of medical provider fraud, healthcare fraud in the United States. And those tools include the Food and Drug Administration having strong recalls for defective products and devices. There are task forces, government task forces investigating Medicare and Medicaid fraud. And most importantly, there's something called the False Claims Act, which is used as a probably the most effective tool to combat fraud, where the government's entitled to treble damages and penalties, and additionally it incentivizes and protects whistleblowers to come forward, which is very, very important to uncovering fraud without insiders or whistleblowers coming forward. And whistleblowers are entitled to an award under the False Claims Act in addition to being protected from retaliation. And that is a huge, huge important tool in the United States combat for fraud by medical providers.
Right, Paul, you were talking a moment ago about the system that is used in Belgium to counter healthcare fraud, and it appears to be a better system, a more efficient system in countering fraud. Is there a case in Europe where you have fraud in one country which could affect patients and consumers in another country?
Well, recently a new regulation, a new European regulation has been adopted on patient mobility, where national healthcare systems allow their patients to seek healthcare in another country under particular circumstances. Installing a system of patient mobility, which is on the one hand very good, you're also installing the risks of exporting and importing fraud in healthcare. So I think what has to be done urgently is to set up a system to avoid these things from happening. And this is one of the most urgent things I think the European Commission has to take on.
Heather, in your experience, does healthcare fraud endanger people's lives? I mean, we've had the experience in the United States where, in one instance, this was, I think, in Chicago, where a cardiologist was carrying out pretty invasive treatments on patients, treatments that were not needed, things like angioplasties. I mean, do you have a similar thing in Canada? Have you come across that?
Yes, there's been a few instances, definitely, with pharmacists actually buying pills and dispensing them that actually have caused fatalities. So we definitely have the same issues.
Raphael, Heather talked earlier on about this perception that there is that healthcare fraud is a victimless crime. I want you to take a listen to what the Attorney General of the United States, the outgoing Attorney General, I should say, Eric Holder, had to say about that. Let's watch this.
I think it's been pretty easy. I think that they have found a way in which they've been able to get pretty substantial amounts of money with not a huge amount of effort, and at least until now, without the possibility of great detection.
With much fewer risks.
Much fewer risks. You'll see some of these people and they'll say, there's not a chance that you're going to have some other drug dealer shooting at you. The chances of being incarcerated were lower. The amount of time that you would spend in jail was smaller.
So, Raphael, there's also this perception in the United States that healthcare fraud is victimless. Is that the case?
Well, I think that that definitely the United States has stepped up the enforcement of it, and have used both criminal prosecutions of many years, as well as these huge civil penalties under the False Claims Act to help enforce it. And I think, again, having a way of rewarding whistleblowers really is the only way to uncover the fraud. When you're talking about $60 billion of fraud, just last year, $2.6 billion of fraud was recovered under the False Claims Act. In other words, giving whistleblowers incentives to come forward will ultimately lead to uncovering information. The government can then prosecute these criminals, put them in jail, recover money that was defrauded, the government was defrauded, and ultimately put them back into United States taxpayers' pockets.
Paul, I want to get back to something that as we've seen here in the United States, and that is the presence of counterfeit drugs. Do you see a lot of that in Europe?
Well, since the internet has become a channel for medication traffic, counterfeit or not, the risk of importing counterfeit drugs has risen substantially. But it must be said that we have to remain very vigilant about the phenomenon, because of the fact that the drugs are being counterfeit, but in 80% of the cases the ingredients are non-active or actually dangerous for your health.
Right. Heather, what about the situation in Canada? Do you see fake drugs popping up there?
Yes, we have had fake drugs, similar to what Paul was saying. There's been instances where the patients have thought they were taking cancer medications and actually they weren't, and that causes grave issues for them. So,
Raphael, we just have a few seconds left. I want to ask you a question about the criminals who are involved in healthcare fraud. Is organized crime involved in this?
Well, I'd say on lesser levels, you do see, if not organized crime, you do see syndicates that are literally forming fraudulent healthcare provider programs where they are organized in billing for services that never existed. They are created really just to bilk the system rather than it being a result of anything sloppy or waste, but it's actually an organized way to try to profit at the expense of taxpayers. So you do see it in an organized fashion, and you see resulting long criminal prosecutions and crackdowns in the United States where multiple doctors are arrested and multiple owners of these fraudulent healthcare providers are arrested for their sham and bilking the United States out of money.
Okay, and that's where we have to leave it. Thanks to all of you for being with us on this discussion. And that is it for this edition of The Heat, but the conversation continues online. Join us on CCTV America's Facebook page to comment on this or any other show, or chat with us on Twitter at CCTV America. I'm Arnold Naidu in Washington, D.C. Thanks for watching.